So our first question to you is, what is photosensitivity and what are some of its symptoms?
Sure. Thanks for asking and thanks for having me here today, Leanne. It's my pleasure on this sunny summer day. Photosensitivity is a reaction to UV light exposure. And the most prominent of the symptoms among these is really a rash. It can be itchy, it can be red, and it comes as a result of exposure to UV light, either from the sun's rays or even from UV light from indoors, like light bulbs.
What are some of what would be some of the symptoms? Is it the rash or what else would someone see as a direct impact from these photosensitivity or the UV rays?
Sure. So the thing that somebody would see most frequently would be a red rash over the sun exposed area. It can extend beyond that. It can be itchy, it can be raised, it can feel burning or uncomfortable, and it comes after exposure to UV light. And at times, UV light can actually trigger a more extensive lupus set of symptoms.
Do we find that, there's a certain time length in which someone may experience that rash, or is it just dependent on the person and the exposure?
So you've said it absolutely right. There's so much variability in terms of how patients with lupus present. We know that up to 70% of patients with lupus have some degree of photosensitivity, and so it's very common among lupus patients. And I think the common denominator is the UV light exposure.
Why are lupus patients more at risk of adverse effects to UV than others?
It's a great question. And we know that UV light exposure is damaging to cells for everybody, regardless of whether they have lupus or not. And that's why everybody's encouraged to use sunscreen with high SPF and so on. Where it interacts with lupus is the mechanism that is aberrant in patients with lupus, and that's because the cells that are damaged, which is something that's true of anyone who sustains UV light damage, they clear a little bit more slowly in lupus, and it's the process of that cellular clearance that is divergent in patients with lupus compared to those without. And because there's this delay in clearance of the damaged cells, this triggers the immune reaction that leads to the photosensitive rash, and in some patients, the lupus flares that come thereafter.
Okay. Yeah, that I was wondering about that if it could trigger a flare. So it sounds like there is potential that it could trigger a flare for some lupus patients.
Because the UV light leads to increased cellular damage and then this aberrancy in terms of how these cells and these damaged cells are cleared, it can trigger a more robust immune response even beyond the skin.
What preventative measures do you recommend for those living with lupus to protect themselves against sun exposure during the summertime? Because everybody wants to be outside, everybody wants to enjoy the lovely weather, but we have to always consider how that will impact someone who is living with lupus.
Of course. So the first thing really is that we want to make sure that everybody lives a happy, healthy, full life. Don't want to be hiding indoors. And so we want to really be balancing these factors. And I would say that for patients with lupus, it really is a balancing act. I'll also add that while the sun exposure and the UV light exposure is greatest in the summer, these are tips and tricks that we can use year round, and we ought to be wearing sunscreens and sun protective clothing even in the coldest days of the winter here in Canada or anywhere in the world, because the UV light is still there. So in terms of recommendations, so first and foremost, if you can avoid being outdoors for extended periods of time during peak daylight hours, so between about 10 a.m. and 4 p.m., that's where the UV exposure is going to be the highest and where anybody's at most risk for sunburns. Thereafter, and everybody wants to enjoy the sunshine. And so to stay in for most of the day is really not feasible, not viable, and probably not desirable for many. And so we have to think about other ways that we can mitigate that. So a good sunscreen with SPF of 50 or higher, and you apply it to any and all sun-exposed areas, not just at the beginning of the day, but reapplying at least every 2 hours, more frequently if you're sweating or if you're in the pool. It's an important thing. Another factor, wide brimmed hats. They're so in style now, and those are going to protect a lot of the rays that come. If you're wearing sunglasses, use sunglasses that have 100% UV coverage. There's also sun protective clothing. And I wanted to pause to comment on this because not all clothing is equally sun protective. We think that
Mhm.
we're fine over the skin that is covered by clothing, but that's not true.
Mhm.
So in fact, a plain white t-shirt is going to actually let about 20% of the UV rays through.
Oh,
And so
wow.
it's really important when we're thinking about sun protective clothing that we look at the UPF, or the UV protective factor of the garments.
Mhm.
And these
Mhm.
are usually on the tags where you're purchasing them. And we know that 30 means that only 1/3 of the UV rays will penetrate. So that's about 3%. Anything that is a UPF of 50 or higher means that less than 2% of the UV rays are going to get through to the skin below. And so that's a nice little rule to look at as one is shopping. Other things that we need to be thinking about are medications that we use that may modify our sensitivity to sun. And so, for instance, certain anti-inflammatories, antibiotics, blood pressure medications, those can all increase the risk of photosensitivity. And so if you're taking one of these medications, and always very helpful to speak with your doctor to see if you're on one of the medications that may increase photosensitivity, then you need to be particularly cautious. Um, Another thing to note is that some of the disease modifying agents that we use in lupus actually do cause increased photosensitivity. And so among these are hydroxychloroquine, almost ironically, methotrexate, and other medications. And so it's important to balance these things and to try to take and layer as many strategies as possible to enjoy your summers.
Yeah, absolutely. Thank you. I also, you noted about if you want to go swimming to, be careful with that. And I think there are some swim gear that you can wear that has that UV protection. So that's something else to consider when you're wanting to be out in the pool. But like you say, try not to go between those core hours where the UV rays are the strongest. You also mentioned that about a bit about sunscreen, and 50 or above is what is most recommended, and to continually reapply. I think we all do that. We say, oh, we put it on, we're okay, but we need to make sure that we reapply that throughout the day to ensure that we are properly covered. And if you've been sweating or if you've been in the pool, things like that, to be cautious of that. Any other tips that you may have for protection during summertime, during wintertime? Like you mentioned, we have to think about this year round. I know that people ask questions about when they're in their cars and when they're, even in front of a window, there's still the UV rays can come in. And I know there's some protective measures that can be taken for that as well. But it's something that someone who lives with lupus, and in particular on some of those medications that you mentioned, could be at higher risk.
Absolutely. Great questions. I think in terms of outdoor management, other things to consider. So if you're near snow, and we don't often think about sun protection when it's snowy and gloomy, but snow is actually sun reflective. And so if you're out and about in a snowy climate, there's actually two ways that your skin can be exposed to UV light: from above and also from the reflection from the snow.
Mm.
Same thing for water. And so if you're in or around bodies of water, you may actually have increased risk of sunburns and just exposure in general. That's important. Cloudy days are deceptive. I think we've all gone out on cloudy days thinking, oh, we're probably okay. And sometimes those are when the best times to be at risk for a sunburn. And so don't let those clouds deceive you. There can be real sun damage that can arise there. And so remember to take that SPF everywhere, no matter the weather.
Mm.
Inside, so certain bulbs have increased UV light exposure. There are filters that can be applied to certain bulbs. If you're using the lowest intensity bulb possible, that can be helpful for those who are the most photosensitive. And even the windows in your car, for people who drive a lot and drive a lot in daytime hours, the incidental UV light exposure, even with the windows closed, can be enough to trigger a photosensitive reaction for some. And so that is where you have to look at the laws a little bit. So there can be tinting that can be applied to windows, but you need to make sure that it is appropriate and legal in your area to do so. And so If you go to a professional location where these things are done, then they can provide some guidance there. But that can be a practical thing that can be done as well.
That's great. That's great. I think, everyone needs to be aware that, keep that SPF with you and make it, part of your routine that, when you get up and put that on and keep reapplying throughout the day, whether it's summertime or wintertime. It's really important because that lovely sun is there. And even when we think it isn't, it is still there and can still be affecting us. That's great.
Absolutely. And we want to enjoy. The other thing that patients will ask me is, what's the best sunscreen? What do you recommend? I always say the best sunscreen is the sunscreen you're going to wear. So people have different skin sensitivities. They have fragrance sensitivities. There's a certain white cast that comes with some of them that
Yeah.
some people prefer to avoid. And so it's whatever sunscreen that is SPF 50 or higher that you feel you're going to wear the most consistently. And that's what I recommend for everyone.
Amazing. Wonderful. Thank you so much. Really appreciate your time to share this with everybody, and everybody wear that SPF lotion. Thank you, Dr. Steiman.
Thanks so much.